Good morning. My name is Maurice Kwizera. I'm a public health specialist. I'm currently working with UNICEF Rwanda and RBC, Rwanda Biomedical Center in Rwanda. I work in risk communication and community engagement in Western Province. The reason why I applied for this opportunity of managers of infodemic training, it is because I work in a risk communication community engagement, and on a daily basis, I have to deal with miscommunication, the rumors. I have also to deal with sharing information. So you have to get right information, which is timely so that you can help the community. And the pandemic of COVID-19 is new. We don't have a lot information as other disease. So you have to learn from others, and the tools that we are using, we don't know are the best one that can help the community. So if you know what others are doing, you can learn from them, as well help them just so that they can also use your tools. Moving to the two questions, I've chosen this one. An early draft of infodemic management strategy suggests indicators for success includes number of hits on the Ministry of Health website, number of likes on the Ministry of Health, Facebook, and number of times the Ministry of Health was quoted by the media on COVID-19 issues. What are some potential issues with these indicators? And do you have suggestion for indicators that measures impact of infodemic management intervention by the Ministry of Health? Looking at this question, the strategy that they raised, it just focus on people who have reached to the website, social media, and doesn't tackle that part of the population that doesn't have access to social media. And that is a considerable number of people. And they have their way of communication, they have channels of communication, and it is important that you reach that part of the population. And through that channels of communication, they can also transmit rumors which can impact on their behavior. So my suggestion as indicators, I would say number of channels of communication that have reported rumors or issues on COVID-19 on weekly basis. And then my second indicator would be among those issues or rumors that were reported, how many were presented to the command post and solved. So by that way, you are sure that different channels of communication, including media, social media, the community, different forums, have reported the issues and you have been able just to solve them. I think that will have impact on the behavior of the community. Second question, how do you go about creating an indicator to track misinformation about COVID-19 and how it affects health behaviors? Yeah, obviously, just there are four steps. And the first one is just the situation analysis, where you have to do literature review, consult experts, do socio-economic, environmental investigation, so that you can find out what gap are there, and you also find out different factors reinforcing, predisposing factors, and different factors that can influence on communication. Then you also develop the indicator. That way you have to develop the methodology, and you also consult different experts so that you refine it. After that, you have to test the indicator so that you measure it and you know it is valid and it is reliable, and you find out what can be improved. Then after, you also reassess the indicator just to improve it, and if possible you can also repeat the cycle. That was my presentation. Thank you very much.